Awesome. Welcome everyone. Hope you had a good lunch or a good break. We're going to wait just a few seconds to let folks trickle in. We're excited for our session today.
Jocelyn, while we're waiting for folks, could folks in the chat share where they're coming in from, and also if they have any questions starting out, if you could share them. And then also we would love to know if you've already started using AI tools in your practice. So we'd love to learn a little bit more about our participants.
Yeah, I love that. Let us know who you are in the chat. Start asking those questions, and I think we're ready. We're going to go ahead and get started. All right, everyone, welcome again to the 2026 Digital Health Summit brought to you by the California Telehealth Resource Center. This year's theme is Bridging the Gap, Digital Health and AI for Smarter Care, Stronger Teams, and Sustainable Healthcare. We're glad you could join us today for today's session titled Trust is Built, Not Bought. Love the name. I am Jocelyn Hyman, and I will be your moderator for this session. On to the next slide. Awesome. Just a quick reminder here that there's still time to register for our other sessions today. So thank you, Crystal. There's a link in the chat. So if you have time for the rest of your day to join us today, please do so. And we hope to see you there. Up next, we have our Microsoft Team tips. So we're all on Microsoft Teams. Like Sylvia mentioned, go ahead and start putting those questions in the chat. We have other features here as well. So you have the option there to open up the chat, raise your hand, or react. We've had some virtual claps throughout our sessions, which is really nice. So feel free to interact with us, and you should be muted for our session. For folks to know, we are recording today's session, and this session will be posted on CTRC's YouTube channel. If you encounter any technical issues, please reach out to to our members at CTRC. And contact us at caltrc@ochin.org. On to the next. We want to thank our funders. The work of CTRC would not be possible without funding and support from the Health Resource and Services Administration's Office for the Advancement of Telehealth and the California State Office of Rural Health, part of the Department of Healthcare Access and Information. Now I'll go ahead and go to the next slide to introduce our presenters. So like I said, I'm your moderator for today, but our lovely speakers, I'll go ahead and introduce them, starting with Sylvia Trujillo. She is a healthcare policy, AI, and digital health strategist with over 20 years of experience advancing technology-driven transformation. She has helped remove barriers to evidence-based digital health adoption, enabling scalable, cost-effective solutions with strong ROI. As Vice President of Policy and Regulatory Affairs at a leading health IT organization and strategic advisor for the California Telehealth Resource Center, she advises providers and innovators on regulatory and payment strategies for AI, remote patient monitoring, and telehealth. Her expertise includes building sustainable revenue models, improving efficiency, and securing reimbursement pathways. Previously, at the American Medical Association, she supported development of payment frameworks, shaping Medicare and commercial policies, and contributed to integrating digital health into standard coding. Round of applause for Sylvia. Next up, we have Lydia Kotowski. She is a healthcare policy analyst and a legal strategist specializing in federal and state legislation, regulatory compliance, and technology-driven transformation across the healthcare sector. She currently serves as a regulatory and policy affairs manager at OCHIN, where she leads nationwide legislative tracking, evaluates the implications of major budget and appropriations measures, and advises healthcare leaders and policymakers on emerging issues, including AI, cybersecurity, EHR modernization, and privacy. Her background spans compliance consulting, public health policy research, dispute resolution system design, and nonprofit leadership. She has delivered high impact work for institutions, including Nationwide Children's Hospital, the Ohio Policy Evaluation Network, Quantum Health, and Children's Law Center. Lydia holds a Juris Doctor and a Master of Healthcare Administration from the Ohio State University and a bachelor's degree in political science and health policy from Ball State University. Another round of applause. Thank you for our speakers. And now I'm excited to hand it over to Sylvia.
Great. I'm going to have you advance the slide and we're going to go really quickly. I want to provide a really important disclaimer, both for CTRC and for Lydia and myself. First of all, as you're all aware, this is an educational session. We are by no means providing legal advice, despite the fact that both Lydia and I are lawyers by training. We encourage you to go back after this session. You're going to get a lot of both regulatory and updates on the legal environment, and also some concrete tools about how to drive towards readiness and compliance. But you really should go to legal counsel to get some feedback and guidance and information, and your compliance team. Also, CTRC has no financial interests or arrangements or affiliations related to commercial products or services discussed in this session. So I'm going to go ahead and advance to the next slide. I want to start, as I hope you all continue to provide comments about what you're currently doing with regard to AI deployments in your practice. But I really want us to ground this conversation in being pragmatic. We're going to talk about some complex ideas and concepts, but fundamentally what we're really talking about is providing tools to your team so that they are responsibly and ethically and effectively deploying AI tools. So we're going to move to the next slide. What I'm talking about is the first activity out of the gate you're already doing. You're attending this session and you're learning about AI fundamentals. CTRC with 20 other organizations, other TRCs around the country, and other entities that are evidence-based and do not have any it's non-biased content, have offered free training for your staff and your leadership in the form of a healthcare AI bootcamp. Foundationally to everything that we're talking about is ensuring your board, your C-suite, all of your staff, including clinical, have undergone this foundational training, and I really urge you to take advantage of this opportunity. It's free, it's on demand. We have 5-minute sessions, there are 45-minute sessions. So that is an excellent place to start for what we're about to talk about. So I'm going to go ahead and move to the next slide. Very quickly, we already know that AI systems in the healthcare environment are ubiquitous. I think by a show of hands, how many of you are already in provider systems that are using ambient scribes, chatbots? Are they assisting with scheduling? We see them show up not only in operational activities, but we're seeing them in clinical practice. And I think most people think that these are relegated to a very discrete number of areas like clinical. And I think that it's important that we keep in mind that when you're developing a regulatory compliance and legal compliance and readiness structure, you need to look at both the front office, the back office, and clinical delivery. And we are really focused on it for purposes of how does it drive financial sustainability, how does it help you combat chronic diseases, and how does it really help you do more with less? And in order to do that, you actually have to make some initial investments in your readiness. We're going to move to the next slide, please. So as we think about where we are today, many of you already, in fact, all of you undoubtedly have a regulatory and compliance framework for the various digital tools you already have in your clinical practice. What we're going to talk about today are really an add-on to the work that you're doing in terms of privacy and cybersecurity, new monitoring enhancements you need to put in place, training, and a better understanding of the tool itself and how it performs in your particular setting. So we're going to move to the next slide. So fundamentally, I'm about to hand it over to my colleague here. She is going to talk about in greater detail the trends that we're starting to see in terms of your increased responsibilities and opportunities to deploy these tools. And the focus is going to be on how are you being transparent with the use of these tools? How are you ensuring accountability? And what measures have you put in place to monitor so you know that your tools are safe? So with that, I'm going to hand it over to Lydia. Oh, I apologize. I went too fast. I forgot about the litigation. So we are focusing on the regulatory legal framework, but one of the things I want to make sure folks are aware of, there is litigation going on, and in fact, it's going on in California. And it concerns ambient scribes. There's at least one other case that's in Illinois. But I want to bring this to your attention because although this is specific to a certain modality, namely recording of patients and clinicians, I'm going to advance to the next slide. These cases really fundamentally have to do with whether you took 5 key steps when you were deploying your AI tools. And not all AI tools require this level of disclosure, consent, and monitoring, but certainly the clinical ones. When you look at these 4 steps, how has your patient consented? What information is captured? Who's holding on to it beyond yourself? Is it being reused? And how did it enter the electronic record? These are really basic questions that you need to grapple with early on. So now I'm going to hand it over to Lydia.
Thanks so much, Sylvia. So up to this point, Sylvia laid out the factors that are influencing trust in health AI and the general health AI landscape. Now we're really going to focus in on current and anticipated AI regulation at the federal and state levels. As we go through the next few slides, the key message I want you to hear is that you don't have to wait, and in fact, you should not wait for perfect regulatory clarity to start acting. As AI and health AI regulation continue to evolve, we can look at different signals from regulators that lay the foundations for good AI governance and maintain the trust of our patients and staff. Next slide, please. Regulation is not waiting for one grand AI law. One of the biggest misconceptions we see is that people are waiting for one comprehensive AI framework that answers every question. That is not what's happening, and that is pretty unlikely to happen in the near future. Instead, regulation is showing up in very specific high-friction moments, things like disclosures to patients, how they support clinical judgment, chatbot interactions, coverage decisions, and what goes into the medical record. And there are 2 major trends to understand. First, we are moving from disclosure to control. Early laws around health AI and AI generally asked, did you tell people AI is being used? What sorts of disclosures did you make? Who needs to know what? Newer approaches and bills we're seeing, particularly during the 2026 state legislative sessions, are asking who is controlling AI, who's reviewing it, is there a human in the loop that can override an AI decision, how is AI validated, and how is it being monitored over time? So lots of questions about how AI is being controlled in the settings in which it's deployed. Second, AI is being regulated through existing laws. Sylvia touched on frameworks that we are all very familiar with, privacy and security frameworks under HIPAA, other general consumer protection laws, general privacy laws that implement or implicate healthcare, and medical standards of care. Those are already being used to govern AI and to inform how AI best practices are developed. So the takeaway here is do not wait for final rules. Build controls that answer the questions that regulators are already asking. Next slide, please. One of the areas that's creating complexity around AI regulation and making it challenging for folks to implement AI in their organizations is this tension between federal and state action. At a very high level, Congress and the White House are largely focused on big picture goals that impact the whole nation. Things like fostering innovation, energy policies around AI use and data centers, and furthering American AI leadership. They're also considering whether and to what extent forthcoming federal law should override state laws and on what topics. We'll get into a draft discussion bill in just a little bit that really asks this question. Federal agencies, on the other hand, are a bit more grounded with targeted regulations, actions, guidance documents, etc., especially groups like CMS and the FDA. At the state level, the focus is much more operational, with transparency, safety, and accountability being key areas of interest. States are where the detailed rules are showing up first, but it's important to keep an eye on what's happening federally because it is definitely instructive and the federal government does have some preemption authority. So keeping an eye on the balance between federal and state regulation is very important, especially when talking about healthcare AI. Next slide, please. So we're going to spend just a little bit of time talking about what is going on federally, what has happened in 2025 and 2026. So starting with Congress, we are seeing that there's a lot of discussion, but not a lot of finalized legislation. There are numerous bills introduced that talk about AI, but many of them are focused on how the government itself is using, monitoring, studying, and preparing for AI in government functions. There are a handful of bills that directly raise questions or regulations around AI deployed in consumer functions or in health specifically, but those generally have seen very little movement. A lot of the discussion is around the government's own use of AI. Second, the administration is focused on enabling AI. The White House has released several executive orders and an AI action plan that are meant to inform how the federal government is addressing things like infrastructure, data accessibility, and global competitiveness. Third, agencies like CMS and FDA are already using and planning how to use and regulate AI within their own agency functions and for the entities that they are responsible for overseeing. CMS, for example, is testing AI in prior authorization workflows for Medicare, though this pilot has some controversial components to it, particularly under a recent appropriations bill that's moving through the House for fiscal year 2027. CMS has also sought information in various payment rules for how to pay for software as a service, recognizing the role that technologies like AI play in care delivery and coordination. As AI becomes more and more present in healthcare, a very key question is who is paying for it and how. So CMS is one of the leading actors that can help answer those questions and help adopt the different codes that will ensure you all get paid as AI becomes part of your day-to-day practices. Another agency, the FDA, is focused on how to evaluate AI-enabled tools and devices. There are softwares and devices that the FDA has already approved that are AI-powered, and there are others that are undergoing FDA review. So when we talk about thinking about the risk of different AIs, an important component in assessing risk is it something that has gone through FDA review? What level of clearance does it have? Or is it something that doesn't rise to the level of medical device, and so it hasn't undergone this very extensive vetting process? So big picture, federal policy is setting a direction and looking primarily at big picture questions, specifically around how the federal government itself is using and planning for AI, but it is definitely not providing a complete rule book yet. One of the closest steps we have on this front is a recent draft discussion bill, so a bill that has not yet been actually introduced in Congress from a few of the leading AI policymakers on the Hill. And I mentioned we would talk about preemption. This bill balances between some of what we've seen from the White House and other congressional discussions around AI and would look at preemption around state laws regulating developers, but leaves a pretty open path for deployers. So this is a relatively novel development in how Congress at least is thinking about preemption, but more to come because that bill is still a discussion bill, has not yet been introduced. So we will be watching to see what happens if it actually gets introduced and if it has legs to move. Next slide, please. So we are at the California Telehealth Resource Center Summit. So we are going to focus in on what is happening in California. California is where we see some of the clearest signals for healthcare AI, and we are noticing a few trends that are all happening at once. First, AI legislation is increasing rapidly. Every year for the past few years, we have seen more bills being introduced that directly or indirectly impact AI development and use in the state. Second, health AI is a very consistent focus. California has for a few years now introduced very targeted health AI legislation on multiple topics, though only a few have actually been enacted into law. Topics of focus for the legislature around health AI include mental health care, prior authorizations, clinical AI, and clinical decision support systems. And third, We are finding that non-AI laws still matter when looking at AI regulation. Sylvia mentioned those privacy, cybersecurity, other frameworks that we're all very familiar with. So even as we're seeing AI regulation proliferate in the state, we are also seeing numerous state privacy, cybersecurity, and consumer protection bills and laws that are also shaping how health providers and vendors are using and deploying AI. And this is highlighted by those two lawsuits that Sylvia highlighted earlier. Next slide, please. One topic that is still an open question that no state has answered fully, even those with fairly comprehensive AI frameworks like Colorado, Connecticut, and Texas, is the question of liability. And that's an important factor for these bills that we're going to dive into in just a moment that you can see here on the screen. So the question of liability for what happens when the output of an AI system causes harm. In healthcare, this has big implications for practitioners in the context of medical malpractice and for providers when determining what liability insurance policies to carry. So looking now at the bills you can see on the screen here, this is just a snapshot of actual California legislation that would directly or indirectly impact healthcare AI or AI generally in the state. Over the past 2 years, we've seen pretty robust activity across 3 main areas: health AI specifically, transparency and disclosure requirements for the state's own use of AI, and chatbots, especially in consumer-facing contexts. This is by no means an exhaustive list, so I'm sure your compliance and regulatory folks, for those of you who are in the state, are tracking some additional pieces, but the point is really to show volume and direction. So looking at those health bills specifically for 2026, AB 1979, AB 2575, and SB 903 are all very targeted health AI bills that have passed their first chamber and are now in the second chamber. Both of the bills that originated in the Assembly are in the Senate. The Senate bill is in the Assembly, and they're really continuing to move through pretty rapidly in their respective chambers. All of them are directly regulating health AI. Those first two are taking different approaches to regulating clinical decision support systems and raise issues around disclosures and notice requirements. There also, AB 1979 also contains a healthcare chatbot provision that has undergone some amendments over the course of the session, so that's been very interesting to watch. And then SB 903 is really targeting how AI is used by mental health professionals or by individuals who would be prohibited from representing that they are providing any sort of licensed care in the mental or behavioral health space under this particular bill. So 3 very interesting ones to watch. Highly encourage everyone to take a look at these and consider how they may or may not impact your practice, although I suspect they all would have some impact on your practice. So what we're seeing in California and other states, one of the most important insights is this: specific bills may change year to year, but the topics and questions being asked are stabilizing. Across proposals, we're seeing consistent expectations that deployers of AI are going to disclose that they are using AI, that developers are going to validate performance, that deployers are going to assign a human to actually oversee and monitor AI as it's deployed over time, and that entities are going to protect data. AI is really only as good as the data it is trained on, and so being very protective of the data that's used to train it and that it is going into it as it is being deployed is really important for maintaining trust of your staff, of your patients, and of trust in the healthcare sector generally. So this isn't about predicting bills that will pass or not. It's really about trying to anticipate what is coming down the pipeline and preparing accordingly. Next slide, please. So some final thoughts before I hand it back to Sylvia. Given the speed at which AI regulation is evolving, the natural question really becomes, what do we do about AI in our organizations? The answer is we get internal controls in place today to build and maintain trust. Internal control or governance considers how you select AI, how you define risk, who owns decisions, and how performance is monitored. What we are seeing from federal and state regulations that are moving and have evolved over the past few years is that if you can lay a foundation of doing these things really well, you're going to be ready for a lot of regulatory models as they come through. So the strategy is not waiting or reacting, it is anticipating and building internal discipline now. I'll now pass it back to Sylvia, who's going to talk about some specific actions you can start taking today to advance AI governance.
So first of all, thank you, Lydia. That was incredibly comprehensive. I'd encourage the folks that we have here today to put into the chat I'm not going to answer all of this. It's really what I would love to hear from you are the burning questions that you have in your mind. Is it a resource question? Is it a concern about whether there's expertise? We would really like to learn more from you about what are your pressing concerns and worries in this space and what are the tools that could help you prepare. And our next part of this conversation is we've laid out a lot of obligations on providers at a time when resources are incredibly constrained and staff are already at capacity. And so I'm going to go to the next slide to lay out some steps that really provide, we think, an opportunity for you to take a step back and to think about how do we create the infrastructure on top of our existing one and integrate what would be foundational governance and oversight for AI tools. And I want to go back to the litigation that's happening already in the state around ambient scribes. Simply taking an approach of we just won't adopt tools and we'll forego all the challenges associated with building the infrastructure is not a solution, even if you don't use ambient scribes. But if you're already using ambient scribes, these are infrastructure and capacity you should already be contemplating, or after this discussion, we have some toolkits and materials that can actually help you get started. And we'll talk a little bit about those in a moment. But foundationally, coming back to what needs to happen, this conversation does not begin with clinicians. It starts in the C-suite. It starts with your board, laying out the broader vision for your organization around AI tools in your electronic health record, AI tools that vendors bring to you, AI tools that are in operations. And you need to account for the fact that many of your staff are probably using some of the more advanced tools, generative AI tools, in shadow use. And so there is widespread reporting that is in fact occurring. And so it's essential that your leadership come together and not get the perfect policy, but get a policy, understanding that you can continually iterate on that policy over time. And the CTRC community and several others that we will outline are really here to help you determine what your next steps are in putting that in place. So the first is the C-suite putting down paper to pen, what is your vision, working on your policy. And oftentimes to get that process started, you need to do a survey of staff and of the tools that you're aware of that are being used. And then from there, after you've established your baseline, and it doesn't have to be like methodologically rigorous. It can be as simple as a link sent out to staff and asking them about their use of these tools. You develop your policy and your procedures, you set the clear expectations, and really foundational to AI tools is this concept of visible oversight, is really understanding not one snapshot in time. We surveyed who's using it, we have a policy, we're done. With AI tools, especially those that have higher risk profiles, you have to have a more dynamic system in place. And so part of your policies and your procedures It includes creating frameworks that can account for the level of risk. And you're undoubtedly going to say, some of you, well, we don't have staff that are able to evaluate relative risk levels. Well, the good news is that there are communities of interest and there are clinical commons, for example, the Health AI Partnership, the California Telehealth Resource Center. We actually do have tools that can help aid you in undertaking that process of building a framework, really understanding what others are doing and finding out best practices peer to peer. The other piece that's really important, especially for those tools that are determined to be high risk, and what is a high risk tool? Let me give you an example of one that's not and one that is. So a high risk tool would be one that's deployed in clinical practice, and it may make recommendations about a diagnosis. That's clearly a higher risk tool than a tool that is used, a generative tool that's used to help craft emails internally to staff about operations. Not in like a medical operations, but the day-to-day operating of your organization. So those tools, they may have similar methods and systems that inform how they perform, but their applications and the settings in which they're used impact their risk profile. And so you have to have a team that comes together, or you join a community of interest where you can learn these concepts and best practices, and you can leverage your resource center for it. The other important concept here is accountability, is ensuring that the tools that you have an owner and that they have oversight, and that your process isn't just a process on paper. It is a process that ensures that you have validated the tools, especially medium and high risk tools, to determine that they're appropriate for the patient population and for the intended purpose. And that over time, you are ensuring that you're monitoring, that you're able to escalate clearly to individuals with higher levels of accountability and authority, problems or changes in tools, and that you have a process for retiring some tools. AI tools in particular can be quite brittle over time, depending on the type of method and system you use. And it may have degraded performance over time. And so, and your patient population could change. There's a lot of factors that can impact the way in which that tool performs. And as you've heard from Lydia, there's quite a bit of accountability in California in particular. I want to emphasize that the AG has already issued letters to a number of large systems asking some of the very questions that this process would answer. Namely, what tools are you using in your practice? Who's accountable for these tools? How have they been validated to ensure they're not biased and discriminatory? How have you monitored them? These are really foundational concepts. And then the other layering from the litigation we're seeing is, did you get appropriate consent? Did you provide appropriate notification? How is the data being used? Are you making certain that you are appropriate steward of the data? So this is a lot of layering we're providing here. The great news is, however, you are not alone in this journey. We are happy to partner with you. And I wear that as my CTRC advisory cap, but you have on here a number of CTRC leaders who have invested a lot of resources and time in building tools that can assist you. So we're going to advance to the next slide. So here are 3 places you can go in order to access some of these foundational toolkits and or trainings for your staff and for your leadership team and your clinical team and others. The first I want to highlight is that CTRC does have a toolkit for C-suite that basically gives you you prop it open, you add water, and it grows. It basically provides an agenda for your first meeting with your leaders to talk about your policy and your framework. It basically gives you the nuts and bolts, an outline of the beginning of a policy for discussion that you fill in. Policies are dynamic, so they really have to reflect the conditions of deployment. And so we'd encourage you not to just pro forma, like fill in information, but really sit down and allocate at least half a day for your leadership to have this conversation. It's a time well invested. These tools can drive a lot of efficiencies, but they can also create some risk management exposure. And now more than ever, your staff can be equipped to be more efficient and upskilled to perform more and better and with less burnout. And you can make the investment by creating an infrastructure to help it. In addition to that toolkit, we have toolkits that CTRC has developed around deployment of ambient scribes and some other key topics that you should come back to regularly as they update the offerings. In addition to CTRC, there is the Health AI Partnership, a national organization that is a convening of major health systems across the nation, organizations like CTRC and OCHIN that basically have created a medical commons of best practices for developers as well as in the context of deployment, and offers really cutting edge, first of their kind guidance and materials that are widely available. They're free, they're not commercially based, and they are evidence-based and unbiased as well. And we've had a very strong and robust partnership with them. And then certainly not last, equally important, I started with it and I'm going to end with it. The Healthcare AI Bootcamp, it has over 20 organizations came together. It's being updated, the content, but the content from 2025 remains evergreen. And I would strongly urge you to schedule staff time to go through and have folks acquire the foundational knowledge that they need in order to ethically and safely deploy these tools. And these materials will be updated on a regular basis. So I'm going to quickly, I saw a few questions in the chat, and I'm going to go ahead and ask Lydia if you can take the first one of the questions, not the first one, but I think it's most closely for the state of California. Will patients be allowed to wipe clean their own AI records, or is it on a case-by-case basis?
So in a lot of these cases, it really depends. There is a data broker law in the state, but that applies to data brokers, not to healthcare institutions. And that data broker law does set up a process by which individuals can go in and request that their information be deleted. And we're seeing that pop up in some other states as well. When we're looking specifically at healthcare and looking at records in healthcare systems, that is really up to the governance processes, at least at this point, for individuals and how their information is governed under HIPAA and the HITECH Act. So patients do have a right to request their information under HIPAA. They can request certain information be deleted. When and how that happens has to align with federal and state laws, as well as your own internal governance practices.
Yeah, I think that's great. And I want to, there's several interrelated questions. And Jocelyn, I'm gonna really work to try to combine some of these because I think the answer is related in some cases. So the first is really about vendors. Both Stephen and Margarita have, I think, very interrelated questions. And I would emphasize that we are at the dawn of the age of really AI. And even in the past 6 months, we've seen the rate of innovation, both in existing health IT systems, as well as integrations like the ambient scribes. The adoption has been very rapid, and the integration into regular clinical practice is only going to increase. So what I would say to folks that have indicated that vendors have not will not have systems in place to allow patients to opt out of AI, or they're moving AI tools that don't allow time for organizations to prep, those are those are not unrelated. I think both of you are expressing concern about the speed. And what I would say is that you actually have vendors, and so the conversation has to be, you're my vendor. Here are my expectations. I need your help because I have legal responsibilities in the state of California that are frankly higher than in other states and in some of your other markets. What tools are you able to offer me and my team for not only readiness, but safe deployment? I also think you have to look at your agreements with your vendors. So we have heard that there are some vendors that are unwilling to fill out the model cards. Amelia Ochoa, along with two physicians, Dr. Hickman and Dr. Lieberman, have an excellent webinar that is evergreen and available on the CTRC YouTube. Jocelyn, if you could share it. It is a video talking about the very specific questions you should be asking your vendors. And there's a model card, which is like a nutrition label that Health AI Partnership developed about 2 years ago and recently updated. And like, they're the basic questions you should be asking your vendors about the performance of their tools. And we've heard some vendors have been very resistant to answering these. And if vendors are resistant to answering these tools, they shouldn't be your vendors. That's the first thing out of the gate. Responsible health IT systems are completing these disclosures, and they're keeping these disclosures available to you, and they're updating these disclosures. So that's the first thing, is that collectively we have to say we have minimum expectations. If you're a smaller organization, it can be very difficult. But most of the major, for example, electronic health record systems are providing these levels of disclosures, and you should ask for them. The second piece I would say with regard to your governance, I would urge you, it is critical that you allocate at least a half a day of your leadership or 2 hours to put in place some of the basic infrastructure. It doesn't have to be perfect. In fact, just by way of example, our organization started our journey in earnest, I would say about 2 years ago. And what we had in place 2 years ago is very different than what we have in place today. It was an iterative process. We have continued literally, I would say weekly, to iterate on our governance, and we now have a far more dynamic and robust governance approach. Now, we are a health IT network, so we have a distinct advantage, as do our members by extension. But what I will say is that this is true for everyone. You feels like you're behind, you're not. We are literally at the beginning of this journey. And so the first step is going to the CTRC website, downloading your C-suite guide, and putting in place your foundational content, and then joining as many unbiased, freely available webinars that can step you through the process. The other issue that I think we're seeing here, Lydia, is how do we safely use AI to perform an analysis of organization reports?
And this could be our last question of today before we wrap up.
Perfect. Well, I can answer that in a couple ways. So if we're talking about organizational reports like your financial report, or maybe some reports for your board, things that are more internal, not clinical facing, would definitely recommend figuring out a way to deploy an enterprise licensed version of whatever generative AI tool you prefer. That's going to be the more secure route to go, is making sure that you have an enterprise agreement that allows there to be some baseline protections around that information, just so it's not going everywhere and being able to potentially be accessed or trained or otherwise leveraged by the overall platform of AI that you're using. So an enterprise license is a great way to go, and that can be for all the individuals in your organization. It can be for a select number of users to pilot or anything in between. It's less safe even if you're not putting in PHI. If you're just dealing with what seems like generic numbers, it's not safe to put in organization-specific details into really any AI tool that you don't have an enterprise agreement with, because you don't know what the protections and liability protections are if something were to happen with that information and somehow come back to you. Certainly, if we're talking about reports that contain any level of PHI or PI that are subject, and that would be personal health information or personal information, protected health information, any of those sorts of items that are regulated specifically under state and federal privacy laws, either of general applicability or to just healthcare, you need to be exercising the standards that are expected under the privacy and security rules of HIPAA and whatever equivalents are in your state. For California, California has lots of health and general privacy laws. So making sure that you're first talking about what kind of reports are we looking at and what data are in those reports and what level of care do we owe to that information and what duties do I have to my organization to protect its own business information. And that generally is going to come down to you need an enterprise agreement for some level of tool, and that enterprise tool is going to need to be able, if it's PHI, need to be HIPAA compliant.
All right. Thank you, everyone, for being so engaging. I know there's so many other questions that we have to answer. We will definitely get back to those. Thank you, Sylvia, for answering some of those in the chat. I do want to echo that the buzzwords video is a great resource to start having those conversations with your vendor. And it really helps you empower to know, what questions can you ask, or, just have a clearer conversation with your vendor, which is really important. Okay, thank you so much, everyone, for being here. Another virtual round of applause for Sylvia and Lydia. We really appreciate the work that you all are doing, and thank you for sharing all this information with us today. Just to wrap up, I'll go ahead and talk about our ongoing support. I'm going to launch our poll right now. If my team can give me a thumbs up to know that it's up. Is it up? Thank you. Thank you, Lydia, for letting me know. I saw your head nod. Let's see. Oops. Sorry, everyone. Bear with me. Awesome. It should be up. Awesome. Okay, thank you. Appreciate the head nods. All right, everyone. If you can please fill out our survey, we just want to hear from you and let us know how we did today. We do want to let you know that we are offering ongoing support as a CTRC program. You can contact us at caltrc.org. If you ever have any questions, feel free to reach out to us. If you'd like to just connect with us and just consult with us a little bit, that'd be great. I'm putting our email in the chat. Here we go. Feel free to connect with us. I'll go ahead and go to the next slide to talk about our resources coming up. So Sylvia alluded to this previously, so I know she shared about it, so I won't go deep into this, but as you all know, there's a 2026 AI cohort series that will be offered with additional office hours as well. It's a great way to build on your AI skills and learn about what's happening right now. I'm going to go ahead and share that link in the chat again for you to join and learn more about the sessions. So visit our website to view what sessions we'll have available and our resources. And please continue to let us know how we did by answering our poll. And then lastly, I launched our poll earlier, so we're good here. We value your input. Go ahead and send us in your answers. But so that you can stay connected with CTRC, We have various QR codes here, so feel free to get connected and scan. But one that I will know is like, go ahead and sign up for our newsletter. Every month we have new themes, we have new resources that we launch, and everything is up to date in our newsletter when you receive it. You'll have our toolkits, our websites, webinars like this one. So that's a great way to get connected with CTRC. I see some responses rolling in, so thank you for all your responses. And I'll go ahead and go to the next slide. Our last thank you. Thank you to our presenters and everyone for being here today. I really appreciate the conversation, love the engagement, and that's it. Please join us for our next session. I'll go ahead and leave the session open so that folks can finish up their survey. We do appreciate your feedback and talk to you all soon. Thanks, Lydia and Sylvia. I'll hold here for a little bit if you're still completing that survey. Otherwise, you're free to go. And we hope to see you in our other sessions. Okay, I'm going to go ahead and close the session.